I think it's very irresponsible that we were informed of these plans so late.
Ravneet Baines is scrambling to come up with a plan for her 5-year-old after learning Thursday that winter break was extended. She isn't alone. Almost all the provinces and territories have pushed back the return to the classroom, many saying they're using the time to get masks, rapid tests, or air filtration systems to schools.
Kids do participate in community transmission, and really we're trying to pull out all the stops right now to slow things down.
In Saskatchewan, though, no changes. Kids there head back as planned this week. Not everyone thinks they should.
We want to delay the start of school in January enough that school boards can come up with strategies for keeping our children and our staff safe. That's all we're asking for, and it's all falling on deaf ears. It's very frustrating right now.
Also frustrating for some, as cases hit record levels, many provinces are no longer reporting school infection numbers. Ontario, among the latest, now only reporting school closures.
It's going to be like wildfire for especially the unvaccinated younger kids. But if we don't have the numbers, then we can ignore that wildfire, right?
Not knowing, especially worrying for many parents of those young kids.
I almost feel like I'm sending a lamb into slaughter.
I think it's a shame if we cannot collect that data, but I could understand that perhaps at this point, there just isn't enough manpower to be able to do all of the types of contact tracing that we would like.
But even harder for Baines, watching her son cope with learning during a pandemic.
My son loves school. He's telling me that he's scared to go into school because he's afraid he's going to get COVID.
A sentiment no parent wants to hear as the roller coaster for students continues. Julia Wong, CBC News, Edmonton.
Well, let's bring in pediatric infectious disease specialist Dr. Fatima Kakar, who is in Montreal. And as we've heard, some provinces have delayed back to school, but at some point, students will be back in classes. So what sort of advice do you have for parents?
Sure, and I know there's a lot of anxiety out there, so I think the most important thing parents can do right now is to have their child vaccinated. About only 50% of school-age kids right now under the age of 11 have had their first shot. And some of that is just waiting for appointments, but some of that is anxiety. So really, please, if you're waiting to get that appointment, make that appointment. The second thing is really having parents and grandparents in that household have their second and third boosters. It's so vital that those who are vulnerable, who have school-age children, be protected. Third thing is really having a well-fitted mask for your child. And regardless of cost and type of mask, the most important thing is that the mask fits your child's face well. And then the final thing is really having rapid tests available for every child who's going back to school.
And let's talk about vaccinations for a moment. The National Advisory Committee on Immunization, NACI, recommends 8 weeks between the first and second dose for children, but Health Canada allows that second dose 21 days after the first, and so some parents are wondering which should they choose?
Yeah, this is a tough question because there's really very little data to guide this answer. 8 weeks is going to have a more durable response, so kids will be better protected going into March break and the spring months. So in general, 8 weeks is very reasonable. However, if you're in a part of the country where there's a surge in COVID, you can get an appointment within a reasonable time frame lower than the 8-week interval. You have maybe vulnerable people in your household, then it could be reasonable to delay it, but I wouldn't go below 4 to 6 weeks because we still want kids to be protected going into the spring months where COVID is still going to be around.
Lots of tough decisions for parents. Dr. Kakar, thank you.
Thank you.